Hai and Assalamualaikum. My name is Muhammad Mohamed Faiz bin Ahmad Kamal. I'm from Gombak, Selangor. I'm a first year accounting student studying in University of Malaya.
Hello guys. My name is Nurisha Zwani binti Abdul Rahim, currently first year student of PACC in University of Malaya.
Hi. My name is Chong Jin Chuan. I come from Penang and now I'm currently pursuing my degree in University of Malaya.
Hello guys, I'm Yo Jun Yi from Group 7C.
What is your feeling after watching those video clips? Sad, depressed, stressed, or down? And yes, these are exactly the feelings of people who are facing mental health problem. Mental health problem is one of the biggest killer in Malaysia. By 2020, mental illness is expected to be the second biggest health problem affecting Malaysians after heart disease. According to the latest NHMS or National Health and Morbidity Survey, every 3 in 10 adults aged 16 years old and above in Malaysia suffer from some form of mental health issue. This is a worth worrying issue. In order to fight against the silent killer, we want to raise the awareness of people about mental illness through this video. Now, let's watch a news about Chester Bennington, an American singer who passed away in 2017, who is also a victim of mental illness.
Welcome to Viva with me, Lukman Haris. In today's show, we start with the news of Talinda Bennington, the wife of the late Linkin Park vocalist Chester Bennington, sharing a heartfelt tribute to her late husband. It was in the form of a video taken just 2.5 days before Chester committed suicide. It shows Chester playing with his son, and the both of them were sampling what looked like candy. Chester was seen jovial, laughing, and even making funny faces. In the post, Talinda wrote the caption, "This is what depression looked like just 36 hours before." And that indeed is the key takeaway of this simple tweet. The post has renewed interest, attention, and even debate into the dangers of invisible depression. And those of you out there, do not let the smile fool you, and do not let the laughs fool you. Someone you know might be suffering from depression and having suicidal thoughts, and you might not know it until it's too late. So keep an eye out on your friends, and if you are depressed, please seek help and don't just keep it to yourself. Depression runs deep and it does not have a face. It may not be visible to you.
To know more about your depression level, just follow us to complete this patient health questionnaire. Over the last 2 weeks, how often have you been bothered by any of the following problems? The first question, do you have little interest or pleasure in doing things? A. Not at all. B. Several days. C. more than half the days, and D, nearly every day. And the second question will be, are you feeling down, depressed, or hopeless? Third question, do you have any trouble in falling or staying asleep or sleeping too much? Fourth, feeling tired or having little energy? Do you have poor appetite or overeating? Feeling bad about yourself or that you are a failure or have let yourself or your family down? Having trouble concentrating on things, such as reading the newspaper or watching television? Are you moving or speaking so slowly that other people could have noticed? Or the opposite, being so fidgety or restless that you have been moving around a lot more than usual? And here goes to the last question. Do you have any thoughts that you would be better off dead or of hurting yourself in some way? Next, we go to the interpretation. For each of your answer A, B, C, D, it is 0, 1, and 2 and 3 marks respectively. So, you will calculate your total score, and if you have 1 to 4 marks, it means that you have minimal depression, 5 to 9 mild depression, and so 10 to 14 marks will be moderate depression, 15 to 19 will be moderate severe depression, and 20 to 27 will be severe depression. It's okay if you have a high total score, you can seek from help from those professionals. Alright, so since our topic is about mental health problem or so-called mental illness, I think before going into mental health problems, we will need to first understand what is mental health. So mental health is just like our physical health. Mental is all about our feelings, emotions, and also moods. So there are both positive and negative emotions. For an example, a negative emotions can be when we feel sad, when we feel angry, or even when we feel stressed. And a positive emotions is when we feel happy, excited, and so on. There's a good mental health means that we need to always be happy, having good emotions. No. We can have both negative and positive emotions. These are always normal to human beings because we have feelings. But then, the key point is we need to express the negative emotions in the right way, or not, we will face some mental health concerns and even mental health problems or illness. Talking about mental health problems is actually referring to our mental health conditions which affect our mood, our thinking and behavior, which including depression, anxiety disorders, and so on. Nowadays, actually many people have mental health concerns from time to time. It's quite normal. But a mental health concern will actually turn into a mental illness when ongoing signs and symptoms cause you feel frequent stress and affect your ability to function. And a mental illness can actually make you feel miserable and can cause many problems in your daily life, such as at school, in your work, or even in your relationships.
Mental illness is a condition that affecting the brain that influences the way a person thinks, feels, behaves, and relates to others around him or her. The symptoms of mental illness may range from mild depressive symptoms to severe behavioral problems. But what actually causes mental illness? One of the few causes of mental illness, number one, is genetic factors. Depression and mental illnesses are often passed on from one generation to another through the genes. This means a person with a family history of mental illness is more vulnerable to develop a mental illness. It is believed that mental illness is associated to various abnormalities in not just one, but several genes. This is the reason why people inherit the vulnerability to develop this illness, but does not inherit the illness itself. Next is physical factors. People who have landed up injuring their head several times in their accidents are seen to damage certain areas of their brain and central nervous systems that lead to mental illnesses. Trauma occurring at the time of the birth can also cause damage to the brain. Moreover, disruption of early fetal brain development can also lead to conditions like autism and etc. Some biological factors, such as chemical imbalance in the brain, are also associated to mental illnesses. The chemicals called neurotransmitters that help nerve cells in the brain to transfer impulses, thereby facilitating communication. However, when this balance dips, messages are not transferred correctly, leading to mental illness. Moving on to the next cause is psychological factors. People who have gone through harrowing experiences in their lives like emotional, physical, domestic violence, sexual abuse, or bullying are often unable to cope with their traumatic past. Sometimes, the death of a loved one, betrayal, or neglect during childhood years also mars the person's emotional state of mind. Sometimes, this can be the reason of mental illness of a person. Last but not least is social and environmental factors. Poverty, living in a difficult and unsafe environment like in war zones, residing in earthquake-prone and other natural disaster-prone areas, living in neighborhoods plagued by gangsters and etc. can also lead to mental illnesses. These people develop a constant fear that conduces to mental illness. Moreover, unhealthy environment factors at home, such as growing up in a dysfunctional family with narcissistic parents or neglecting parents, can also cause the balance of the child's brain to tip. The person's appearance regarding height and weight also can cause depression in certain people.
Hi, now we will discussing about ways to maintain positive mental health. So, by taking care of mental health doesn't mean that you only need to go for the treatment with the professional only, but also you need to improve emotional health by doing on your own. By doing some changes, this can boost your mood, resilience, and also can make you happy every day. What we need to do? So first and foremost, you need to value yourself. Always treat yourself with kindness and respect. By having positive thinking about yourself and always be thankful with everything you have, this can promote feelings of self-worth as well as happiness. Don't ever try to compare yourself with others, as this will only downgrade yourself, as you will feel that you are bad compared to others. Next is to keep active. So start from a simple activity as you can, like going on a short walk, and then try to aim for more, like doing some daily exercise for at least 30 minutes or going for some outdoors activities. So by doing some outdoor activities, you have a time with the nature, and this you have a tendency to settle down all the anxieties you have, as well as you can reduce your stress. And the third one is social connecting. So be surrounded with the good people that always support you during difficult times. So by having a better relationship with your families and friends, will tend you to be more healthier and happier. You can also plan some activities with them, like going for some trip or camping, and this can strengthen your relationships. Also, this can add to your overall enjoyment in your life and reduce your stress. Next is to get your healthy meal. So by having a healthy meal actually will keep you focused and have a healthy body. Research shows that you will feel much more better when you have a healthy diet and return you to have positive impacts both in mentally and physically. So do get your healthy meal to keep your mental health in good conditions. Last but not least, try to get enough sleep. No matter how busy you are, try to get enough sleep as it is very important to maintain your mental health. Having less sleep actually can mess your mood and run your day, and this will give a very bad effect and turn you to be stressed. So it is very important for you each night to get a very quality sleep by trying to take a break from the stimulation of screen like phone and televisions at least 1 hour before bedtime.
Despite the seriousness of the mental health problem, you may ask, why don't we take prompt action to solve it immediately? However, in reality, it is a very tough issue to be solved as there are a few challenges faced by us in our battle with mental illness. First, the stigmatization of mental illness. Stigma is defined as a label of disgrace that sets a person apart from the others, whereas the stigmatization of mental illness is the formation of negative belief and assumption towards a person suffering from mental health problem. Negative attitudes and belief towards this group of people create prejudice, which in turn leads to negative action and discrimination. Over time, the stigmatization gave rise to extreme actions like chaining and abusing, systemic denial of opportunities, as well as name-calling or social shaming. Compared to the other barriers, stigma towards mental illness is perhaps the most difficult barriers to overcome, since it involves ingrained beliefs and assumptions. Second, lack of awareness about mental illness poses a challenge to the mental health issues. Due to the complacent behavior of mental illness sufferers, the issue of mental illness is something that not being given enough exposure and attention in the mass media space. Generally, it's believed that the public doesn't have enough access to mental illness literacy, thus not equipped with sufficient knowledge about mental illness. With better knowledge about psychiatric illness and treatment options for those illnesses, they could know what to do next and who to seek help from when people faced with such problems. Moreover, patients with mental illness symptoms can immediately be detected by the surrounding people who are aware of mental health issues. Third, the high cost of treatment for mental illness. According to a research done by Penang Institute, in private healthcare sectors, annual treatment for depression costs around 4,491 ringgit Malaysia to 8,147 ringgit Malaysia. While these charges may be considered affordable to the middle class and high-income groups, the poorer groups would certainly find it challenging to pay for these expenses, especially when poorer groups and those living in the rural areas tends to be more vulnerable to develop mental health problems. The fourth challenge, exclusion of mental health coverage in medical and health insurance, or MHI. According to General Insurance Association of Malaysia, or Persatuan Insurance Arm Malaysia, MHI policies are generally designed to cover the cost of private medical treatment, such as the cost of hospitalization and healthcare services if an individual is diagnosed with a covered illness or has had an accident. Health insurance play a big role in reducing the barriers and seeking private specialist treatment. But to this day, health insurers in Malaysia do not offer coverage for mental health. Most of the insurance company did not recognize mental illness as part of the critical ills that need to be cured by providing proper treatment. This situation leads to discourage of people seeking the proper treatment for mental illness that they are suffering, as they do not want to tarnish their medical records. Fifth, the shortage of psychiatrists. Psychiatrists are the specialist doctors who have specialized training in the field of mental health care. Access to psychiatrists is an essential cornerstone of any mental health care system. The availability of trained and qualified mental health care providers in the public healthcare system has a clear bearing on the access to treatment. In Malaysia, the supply of psychiatrists in the public healthcare system has lagged behind the number of other clinical specialists for several years. From 2009 to 2013, psychiatrists registered the lowest increase in number among all hospital-based clinical specialists, both in the public and private sector. On 2nd April 2017, Health Ministry Deputy Director General Datuk Dr. Jaya Indram Sinadurai publicly stated that the Health Ministry was aware of the lack in mental health facilities in Malaysia and was working towards getting more psychologists and psychiatrists in the service.
Next, we'll be talking about what can we do when our friends have mental health problems. How can we help them? People who have mental health problems, they actually needs a lot of care and also support, especially from their friends and family. So what can we do? First of all, we need to be supportive by listening what they feel, and you need to let them know that you are always there for them and they are not alone. And lastly, always be patient when you help your friends who have mental health problems. They may not accept your help at first, but don't give up that fast. Just try it out from time to time, and lastly, they will actually accept your help.
So, what are the implications if mental health problems are not served properly? First and foremost, the implication will go to the patients themselves, as the individual with psychological disorders are at a greater risk for decrease of quality of life, having educational difficulties, and lowered productivity. Mental illness patients are generally hard to get a job. Thus, the mental illness will increase the risk that the individual will drift into or remain in poverty. Moreover, mentally ill individuals are vulnerable to low quality care, having abuse and human rights violations, particularly in low income areas with limited mental health care resources, and they may also experience significant social stigma and discriminations. The next implications is there will be increased burden of patients' families member, including the financial member. As we know, it is not easy as we think to take care of someone who are having a mental illness. So the burden of caring for a mental ill individual will often fall on the patient's immediate family or relatives. So the families and caregivers of individuals with psychological disorders are often unable to work at full capacity. This is due to the demands of caring for mentally ill individuals, and this will lead to the decreased economic output and a reduction in the household income. So there will be a loss of income and the poverty. Thus, from here, we may know that the family member may also experience significant and chronic stress due to the emotional and physical challenge of caring for a mentally ill family member. Last but not least, besides it affects to the family members and also to the individual, it will also affect to the social. Although the specific societal impact of mental illness varies among the cultures and nations, untreated mental illness has also significant cost to the society. For example, the psychological disorders can worsen other public health issues, This will increasing the burden on national economies and will slow down the international public health efforts. Besides, maternal depression may put infants at increased risk of low birth weight, childhood health problems, and incomplete immunization, which are all of these are the risk factors for the childhood mortality. So, the financial and social burden on the communities and nations might give effect to the society, which is increase the violation cases.
Mental health is something that we all have and need to take care of. Just like if you had back injury, you will see the appropriate doctors, right? You will experiment with new ways of treating your back pain. You will heal your back pain. Then you will take certain measures to prevent your back pain or injury from reoccurring. Mental health, in many ways, is just the same. These are the different stages that mental health patients experience. The first stage is called preconception. In this stage, you are vaguely aware that something seems off and may be in denial. Some may notice and even make comments that something feels off and just continue to go about their life without taking any further action for help or change. The second stage is called contemplation. In this stage, the person's symptoms have started to interfere with daily functioning. They have acknowledged there is a problem, or their loved ones may have said that it is time to seek for professional help. However, most people have mixed feelings about seeking help. They worry about the stigma of treatment and are scared that something is wrong with them, or they just afraid that they may be crazy. The third stage is called crisis. Typically, this stage can be avoided if you recognize you need help in stage 1 or stage 2. However, if you do not recognize you need help once you reach this stage, you may experience feelings similar to having a nervous breakdown. These feelings of being in crisis mode or sensing an impending crisis will most likely leave you to struggle to function at home and at work. The fourth stage is called seeking help. Ideally, this stage occurs before the crisis. However, in most cases, the crisis is what prompts the call for help. Unfortunately, the mental health care system can be slow, confusing, and scary. At this point, it is very vital that you find a provider who can help you quickly. Next, the fifth stage is engagement. This is the stage where you start to actively work with your health provider. Because the relationship is still new, trust can be challenging at this point. For some, this may be the first time they are allowing their emotions and feelings to surface, and expressing them can be very painful. At this stage, it is very important to begin the process of developing trust and sense of partnership with your health provider. The sixth stage is called recovery. This is typically a longer phase where the person works with the provider to find long-term solutions to their problems. They begin addressing disempowering patterns or habits of behavior that no longer serve as coping mechanisms. This is also where your doctor will help to find new ways of empowering yourself to live a meaningful, healthier, and happier life. Lastly, the seventh stage is called maintenance. This phase is often ignored but very important. You need to plan to check in with your health provider even though the problem or problems have been addressed, because if you do not check in regularly, an unexpected crisis can arise that could derail your progress. That's all we want to share with you in this video.
I hope you enjoyed the video and learned something from it.
Remember to like our videos and share it to your friends.
See you next time.
Together, we fight against mental illness.
Together we fight against mental illness.
Together,
we fight against mental illness.
Together, we fight against mental illness.